Hi, my name is Jerry Hesch, and I work at Hesch Institute in Henderson, Nevada, very close to Las Vegas. This is, in fact, the most remarkable case study I've ever seen. In over 30 years of practice, I have never seen someone present like this. This individual had significant widening of the pubic symphysis joint, which was demonstrated on X-ray. And it was also demonstrated with her standing on one leg and then the other that there was 2 to 3 millimeters of vertical excursion. And this was congruent with delivering a 10-pound plus baby some time ago, several decades past, I believe, and also suffering several falls. And this client was on her way to get a sacroiliac fusion and chose to come see us. And I was absolutely astonished when I was checking out pelvic posture, pelvic mobility and such. And when I went to palpate the pubic bones, which are usually this close together, on her they were this wide. So that certainly got my attention. And when I palpated across, I was even further astonished, because what is typically a very minor divot of a couple millimeters, which is normative anatomy when you're palpating the fibrocartilaginous symphysis, with her, it was deep, and it was so deep, I used a tool to measure. We have that on a separate video. And I used that tool to measure, and I also used my thumb and my finger to demonstrate, and it was considerable. It was approximately 3/8 of an inch. Never have seen someone present with that, and based on that alone, I would have expected her to come in on a wheelchair or to have already had symphyseal stabilization surgery with plate and screws. However, what maintained stability and allowed her to function, albeit with some pain and some degree of dysfunction, but she was able to walk in the door on the first visit, was that her sacrum was stuck in posterior glide. It's a common pattern we see with falls onto the buttocks, and the sacrum wedges posteriorly, and basically the entire pelvic structure becomes very rigid. There's no accessory motions in the ilium, ischium, wherever you spring to create movement going through the SI and movement going through the pube. What was interesting is she did have some motion preservation. There was some vertical up and down motion and a little bit of rotational motion. Earlier she had been diagnosed as having a right posterior ilium with an upslip and a left sacral rotation, and she had none of the above. That was simply a postural muscular response within the joint. The pube was at least theoretically unstable, but again, because the sacrum was wedged posteriorly, that created a degree of stability in her pelvic structure. Again, one of the most remarkable cases. I thought that she and her husband might want to make a few comments, so I'd like them to give us kind of a summary of their efforts to get appropriate care and how long they've been trying to get care and their experience here. And so we're not going to include their face. We're going to respect their privacy, but they're happy enough to share some thoughts, so thank you.
Alrighty. It's been a long road, 12 plus years, in trying, first of all, to get a diagnosis, which we finally did receive approximately 5 years ago, and that was termed as pelvic obliquity, which still leaves pretty much of a wide gap as to exactly why, when, and what to do about it. And so I attribute the fact that, first of all, I decided I was not going to leave any stone unturned, and went through some physical therapists and actually traveled outside of my own state for that. And at the very end, toward a few months ago, I got to the point where I said, well, the best thing to do is perhaps surgery and just be done with this. And it happened that my husband had researched online and studied about Jerry Hesch Institute, and given me some papers a year and some months ago, and a lot of things happened, and finally I researched it on my very own, actually about 12 or so days ago, and I made the phone call. I found out about Jerry and studied more, and immediately decided to come. and see what he had to say prior to my having any type of surgery, which is planned to be in the near future. And so walking through this door truly was a blessing to me, because I had learned quite a bit more. I was given the truth about my situation. What, why, when, and where was not, they were not only answered, but I was also taught what to do about it. As anyone in my condition would say, they want to own, they want ownership of what is going on. They want the true facts of what is going on, and then they want to know what to do going forward. And all of those came to me by coming here to visit with Jerry Hesch. And it's, again, it's been rewarding, and I've left knowing that I do not have to have surgery, and which is always the best thing for anyone to hear. And from this point on, I feel like I have a sense of control once again, which I felt I lost for so many years. And I'm very, very thankful and pleased.
Sure.